Hi, my name is Dr. Julie Khlevner. I'm a pediatric gastroenterologist and associate professor at Columbia University Medical Center and work at Columbia University College of Physicians and Surgeons. You probably know functional constipation is one of the most common conditions treated by pediatricians and pediatric gastroenterologists. And in general, younger children across numerous diseases and disorders have limited evidence-based treatment options. This is especially important for functional constipation when dietary changes, behavioral interventions, and over-the-counter laxatives are just not enough. The FDA's expanded approval of linaclotide for children as young as 2 really provides clinicians with the first FDA-approved prescription therapy specifically indicated for functional constipation across a broader age group. It helps address an important treatment gap, particularly for preschool children who can experience chronic symptoms that affect quality of life, toileting, feeding, school readiness, and overall family's well-being. So from a clinical perspective, the most relevant outcomes can include resolution of painful defecation, since fear of pain can reinforce stool withholding behaviors in young children. It's also important to have reduction in fecal incontinence or soiling episodes because that also affects quality of life, school attendance, and overall family's well-being. Improvement in stool consistency is important, and decreased stool withholding behaviors as part of the treatment overall improvement, and sustained symptom improvement over time rather than short increase in bowel movements. And probably one of the most important ones that usually is overlooked is the quality of life improvement for both children and their families. So we recently published the European Society and North American Society for Pediatric Gastroenterology, Hepatology, and Nutrition guideline for the treatment of functional constipation in children aged 0 to 18 using utmost rigorous grade methodology. The guideline provides an easy-to-follow, evidence-based algorithm where education, lifestyle, behavioral, and dietary advice, along with over-the-counter laxatives, remain the cornerstone of treatment at this time. Although if there's lack of response, over-the-counter treatments are just not well tolerated, either due to refusal to take it or side effects, linaclotide can be considered an effective treatment option. Although this approach is not prescriptive, and some clinicians may choose to incorporate LINZESS early on in the treatment, depending on the patient's symptomatology and presence of other conditions, for example, neurodevelopmental conditions, where refusal to take many medications can be a burden to overall treatment response, and therefore having an option where you can open a capsule with established safety profile is appealing to many clinicians. So the ability to administer something in applesauce or water can be highly important in younger children, particularly the preschool age ones that are really picky and often are unable or unwilling to take large volume of liquids, pills, chewables, suspensions, etc. In pediatric practice, ease of administration is a key determinant of adherence, and even an effective therapy may have real-world benefit if families struggle to give it consistently. From a practical standpoint, alternative administration methods can reduce treatment burden for both caregivers and children, improve acceptance, and support more reliable daily dosing. This is especially relevant in functional constipation, where therapeutic success often depends on sustained treatment over months rather than intermittent or once use. I always try to set realistic expectations and counsel families that improvement takes time and that ongoing treatment may be necessary even after symptoms begin to improve. It's also important to have interval check-ins with the family to monitor for treatment response and tolerability as we embark on this pathway. So the availability of an FDA-approved prescription therapy for children at this age group has the potential to meaningfully influence the long-term management of functional constipation by providing clinicians with an evidence-based treatment option specifically studied in this young patient population. Successful management may improve several aspects of quality of life, including lower caregiver burden and greater confidence in treatment decisions. Even for clinicians and families, it's important to have a reliable therapy with regulatory approval and pediatric efficacy and safety profile that's been established and well studied. And looking ahead, the greatest impact may come from integrating the FDA-approved therapy into really a comprehensive management strategy that also includes education, behavioral interventions, toileting routines, and ongoing follow-up for the best treatment success.